Hello parents, I am Dr. Deepak Gandhi, working as a pediatrician in Dubai. Let's discuss about diarrhea and children. There are many questions which parents want to know about. Let's discuss what is diarrhea, what is not diarrhea, why a child has diarrhea, what kind of food I can give to my child in diarrhea, what kind of fluid I can give, whether my child will need antibiotics or not, how should I ensure that my child should not become weak, and whenever child develops diarrhea again and again, what should I do? So, there are many questions. Let's discuss all these questions in detail so that you do not have trouble while handling the diarrhea for your child. So, the first question is, how do I suspect that my child is having diarrhea? When the stool is unusually loose or watery and occurs at least 3 times within 24 hours, we can call it diarrhea. It depends on the recent change in consistency of the stool and frequency of the stool. Because if a newborn baby who is feeding and passing stool after each feed, it may not be a diarrhea even. Normal child or a normal person passes 1 to 3 stools which are formed and soft, and they pass it without any difficulty. So, we don't call it a diarrhea. It is a stool frequency for anyone. So, the first questions parents ask me, why does my child have diarrhea? Diarrhea can occur due to many reasons. Most common of them are viruses. And out of all viruses, rotavirus is the most common VAN, which affects the children of younger age, especially less than 2 years of age. And a matter of fact, apart from this, there are other few reasons, like bacteria, parasites, reactions to medicines, food, allergy, intolerance to food substances, or few other disorders of the intestine, which can cause diarrhea in your child, and the organ which is affected by the diarrhea is the gut. So, the route of entry is oral cavity or mouth. So, the diarrhea usually develops in the setting of poor and hygiene. Whenever there is a lack of safe drinking water, improper hand hygiene while preparing the food, or handling the food, or handling the child, or leaving the cooked food uncovered, using the utensils which are not clean, bottle feeding, consumption of unpasteurized milk or unhygienic street food, improper disposal of excreta. All these are the common reasons for diarrhea. Parents, be alarmed. Even after taking all the hygienic precautions, your child still can get diarrhea because there are so many other reasons, like viral infections, which come through the air and you cannot control them. So, the next question comes, what kind of food or fluid I should give to my child when he or she is having a diarrhea? Your child has a diarrhea means he is losing water and electrolytes in the stool. So, the first thing to cover is electrolytes and water. So ORS, oral hydration salt, is the best to recover from it.